The anatomy of the udder and the clinical consequences. Defense mechanisms of the udder in cattle. For the udder anatomy, 400 litres of blood go into making 1 litre of milk, and the udder weight is 50 to 75 kilograms. For the anatomy of the udder, we have the teat cistern, the gland cistern, and the teat canal and the teat orifice. On either side of the teat canal, there's the teat sphincter muscle. And at the very top of the teat canal, there's the rosette of Furstenberg. In the secretory alveoli, there are myoepithelial cells, and there's also milk-secreting cells on the inside. So for the teat structure, there's 1 teat canal and 1 cistern per teat. The teats increase in length with age, with the first 3 lactations. They also increase with the diameter with age, during lactation. There are 4 layers: the epidermis, the dermis, the muscles, and the endothel. In the epidermis, there are keratinized cells. There's no hair follicles, no sweat glands, and no sebaceous glands. It can be up to 5 times thicker than skin, and it's difficult for surgical care. There are many nerve endings. The dermis has the blood vessels and nerve endings to the epidermis. And for the muscle layer, there are circular, longitudinal, and oblique layers, and a sphincter smooth muscle. The sphincter muscle closes 1 hour to 1.5 hours after lactation, and this increases the risk of infection. This is why you should maintain the animal standing during milking and post-milking, and you need to have dipping and good hygiene. For suspension of the mammary gland, there's the deep median ligament and the median ligament on the inside. And then there's the superficial lateral ligament, which is here laterally. And then there's the prepubic tendon. For the defense mechanisms of the mammary gland, there are anatomical barriers and innate immune responses. The anatomical barriers are the first line of defense. There's the sphincter muscle of the teat canal, and it closes around 2 hours after milking. And these are the Furstenberg rosette. And also, the teat canal itself is stratified with epithelial cells and they form a keratin plug at drying off. And for innate immune response, you have the alveolar macrophages, such as TNF-alpha and IL-1B, and they can act almost immediately. Also, neutrophils are recruited from the bloodstream.